Here we are in 2013, and there are still roughly 1 million myocardial infarctions that happen per year just in the United States alone. And of those 1 million infarctions, we currently cannot predict a single one of them before they happen. And so this remains a very significant public health problem that people continue to have sudden onset of myocardial infarction. And if you're lucky and you have a myocardial infarction, you make it to the hospital and we can treat you. If you're unlucky, unfortunately, you die before you get here. And so we very much want to develop the scientific methods to be able to predict a myocardial infarction before it happens. And that's the background that really led to our STEMI study. What we found was that in 19 of the first 20 patients that we did with STEMI, and 19 of those culprit lesions actually had lipid core plaque present. And in 17 of the 20, a very large lipid core plaque was present where the lipid core wrapped almost circumferentially around the vessel at the culprit site. So based on our findings, we were able to come up with a signal, a near-infrared signal or signature of the culprit lesions that actually we think cause STEMI. Why this finding is important is because unlike the thrombus that occurs at the time of the event, we suspect that the lipid core may actually be in the artery well before the infarction happens. And so if the lipid is in fact there well before the event, then the lipid core is something that can be detected before the event occurs and may be able to be used to predict the event before it happens.